There's a moment, usually around month 3, when the victim realizes something is wrong. Their memory seems unreliable, their confidence has vanished. They apologize constantly for things they did not do. But here is what makes psychological destruction so effective. By the time you notice something is wrong, the infrastructure is already in place. You have already been conditioned to doubt yourself more than you doubt the person destroying you. Today, I'm going to show you the 7 clinical signs that someone is systematically dismantling your psychology. These are not opinions. They are documented patterns identified by forensic psychologists, trauma researchers, and now codified in criminal law. Some of you will recognize yourself in what I describe. That recognition is the first step out. This is covert influence, where we dissect the mechanics of manipulation. What you do with this knowledge is your choice. Here is what we are covering. I'm going to walk you through 7 signs of psychological destruction, each backed by peer-reviewed research from institutions like Harvard, the University of Pennsylvania, and clinical frameworks now used in criminal courts. For each sign, I will explain the mechanism, how the predator deploys it, and the moment most victims miss. By the end, you will have a clinical checklist, not to diagnose anyone else, but to recognize what might be happening to you. Let us start with sign number 1, reality erosion. Sociologist Paige Sweet at the University of Michigan published a study in the American Sociological Review in 2019 that finally gave clinical language to something victims have described for decades: gaslighting. She defined it as psychological manipulation designed to make victims seem or feel crazy, creating what she calls a surreal interpersonal environment. The mechanism operates through 3 channels. First, the predator mobilizes cultural stereotypes. They exploit associations between emotionality and irrationality. If you get upset, that proves you are unstable. If you stay calm, you're cold and uncaring. There is no correct response. Second, they weaponize structural vulnerabilities: immigration status, financial dependence, children. Anything that makes leaving difficult becomes leverage. Third, and most importantly, they systematically deny events you experienced. That conversation never happened. You're imagining things. I never said that. Here is what is actually happening neurologically. When someone you trust consistently contradicts your perception of reality, your brain faces a conflict. Your memory says one thing, the person you depend on says another. Over time, the brain resolves this conflict by discounting its own signals. You learn to distrust yourself. The observable signs are consistent across clinical literature: constant second-guessing of your own decisions, apologizing when you have done nothing wrong, leaving conversations more confused than when you entered them, difficulty trusting your own memory, and a pervasive, low-grade anxiety about whether you can distinguish what is real from what is not. Victims frequently describe feeling like they might be going crazy. That feeling is not a sign of mental illness. It is a sign the technique is working. There's a compounding mechanism here that researcher Jennifer Freyd at the University of Oregon documented. When victims confront their abusers, they commonly face what Freyd calls DARVO: deny, attack, reverse victim and offender. The perpetrator denies the behavior, attacks the victim for bringing it up, and reverses the roles so the victim is now the aggressor and the perpetrator is the wounded party. Freyd's 2017 study found that exposure to DARVO significantly increases victim self-blame and decreases how much observers believe the victim. The predator does not just distort reality. They make the victim look unreliable to everyone else too. Sign number 2 is identity destruction. Dr. Judith Herman, professor of psychiatry at Harvard Medical School and recipient of the Lifetime Achievement Award from the International Society for Traumatic Stress Studies, documented that prolonged psychological abuse produces what she termed complex PTSD. This diagnosis was officially recognized in the ICD-11 in 2022. One of its core features is profound disturbance in self-perception. Victims commonly report a specific phrase: "I am not myself anymore." French psychiatrist Dr. Marie-France Hirigoyen wrote a clinical text called Stalking the Soul, where she describes perpetrators who attack the victim's sense of self in ways that leave no visible sign. The destruction is invisible but total. Research published in 2013 found that identity damage persisted long after physical wounds healed. Victims described feeling emotionally and mentally lost touch with who they were. The observable markers are distinct: inability to identify personal preferences, values, or goals independent of the abuser; chronic shame and self-blame that attaches to everything; confusion about core beliefs you once held firmly; a sense of being hollowed out like a shell of the person you used to be; and in clinical assessment, what therapists call identity diffusion, where the boundaries of the self become unclear. A 2025 study demonstrated a direct pathway. Childhood emotional abuse leads to identity diffusion, which leads to hopelessness. The destruction of identity is not metaphorical. It is measurable. It shows up on clinical instruments, and it predicts suicidality. Sign number 3 is trauma bonding. This is where most people get confused. They ask why victims stay. They assume staying means it is not that bad, or that the victim is somehow complicit. The research shows the opposite. Dr. Patrick Carnes, internationally recognized addiction specialist, coined the term trauma bond in his 1997 book, The Betrayal Bond. He defined it as dysfunctional attachment that occurs in the presence of danger, shame, or exploitation. The paradox is real. Victims become more attached to those who harm them. Researchers Donald Dutton and Susan Painter at the University of British Columbia developed the explanation. It requires two factors: power imbalance and intermittent reinforcement. That second factor is critical. Intermittent reinforcement means unpredictable cycles of abuse and affection. Sometimes the predator is cruel, sometimes they are loving. The victim never knows which version they will get. This unpredictability is not a bug, it is the mechanism. Dutton and Painter's 1993 study found that relationship variables accounted for 55% of variance in attachment measures. That is an enormous effect size. Even more disturbing, attachment decreased only approximately 27% after 6 months of separation. The bond persists long after the relationship ends. Here is why this works neurologically. The pattern mirrors slot machine conditioning. In behavioral psychology, unpredictable rewards produce the strongest, most extinction-resistant behavioral patterns. The occasional good day, the moments of affection, the honeymoon periods, these function like random jackpots. They keep the victim engaged, hoping the good version will return. Observable signs include defending the abuser to others even when you know what they have done, inability to emotionally detach despite clear evidence of harm, obsessive thoughts about the relationship, continuing to seek contact after leaving, and experiencing withdrawal-like symptoms when attempting to separate. Victims frequently recognize intellectually that the situation is harmful. They can list the abuses, but they describe being unable to break the attachment. This is not weakness. This is conditioning. Sign number 4 is learned helplessness. Dr. Martin Seligman at the University of Pennsylvania conducted foundational research showing that when organisms learn outcomes are independent of their responses, this learning undermines escape behavior. A 2016 neuroscience update revealed something remarkable. The original theory had the mechanism backwards. Passivity is the brain's default state. Control must be learned. Prolonged aversive events cause what researchers call unlearning of control. Here is how abusers exploit this. They subject victims to unpredictable abuse that teaches 3 attributions. First, the situation is permanent. It will never change. Second, it is personal. It is your fault. Third, it is pervasive. You cannot do anything right about anything. Once these 3 beliefs take hold, the victim stops trying to escape. Not because they lack resources, not because they lack intelligence, but because their brain has literally unlearned the connection between action and outcome. Observable clinical signs include failure to respond or try when faced with new challenges, low tolerance for any obstacle, inability to learn from success because success feels random, passive acceptance of ongoing abuse, and most striking of all, inability to leave when escape becomes clearly possible. This last marker is the signature. The victim has resources. The door is open. Friends are offering help. But they cannot move. Their nervous system has learned that action does not produce relief. The mechanism is neurobiological. Serotonergic activity in the dorsal raphe nucleus inhibits escape behavior. This is not a choice. It is a state. Sign number 5 is nervous system restructuring. Dr. Martin Teicher and Dr. Jacqueline Sampson published a landmark review in the Journal of Child Psychology and Psychiatry in 2016. They analyzed brain imaging studies of abuse survivors and found something disturbing. 30 of 37 studies showed reduced hippocampal volume in abuse survivors. The anterior cingulate cortex showed consistent reductions. The corpus callosum, one of the earliest findings in this research area, showed significant reductions in 16 of 21 studies. The body keeps the score in measurable tissue changes. The HPA axis, which regulates stress hormones, becomes dysregulated. A meta-analysis of 30 datasets covering over 4,000 individuals found a moderate effect size for blunted cortisol response to social stress. The victim's stress response system stops functioning normally. Emotional abuse, specifically, is associated with delayed recovery following acute stress. The system stays activated longer than it should. Chronic cortisol elevation causes neuroinflammation and oxidative stress. It can cause the hippocampus, essential for memory, to physically shrink. Observable signs include constant startle reflex, scanning environments for threats, misinterpreting benign situations as dangerous, chronic muscle tension that never releases, sleep disturbances, exhaustion that sleep does not fix, an inability to relax or feel safe even in objectively safe environments. The physical health consequences are documented in the Adverse Childhood Experiences study, which tracked over 15,000 people. The findings show dose-response relationships. More psychological abuse correlates with more autoimmune diseases. more cardiovascular disease, more chronic pain conditions. The destruction is not just psychological, it is physical. It shows up in tissue and blood work and imaging. Sign number 6 is cognitive impairment. Multiple meta-analyses document cognitive deficits in abuse survivors. Impaired executive function, working memory problems, reduced processing speed, poor sustained attention, fragmented autobiographical memory. A 2025 study in Psychology, Research, and Behavior Management specifically examined what survivors call brain fog. Researcher Dr. Sandra Brown, founder of the Institute for Relational Harm Reduction, describes the victim's experience as scrambled egg brain, inability to focus, what she calls ping-ponging monkey mind, cognitive fog. Survivors call it the ultimate mind screw. Her research found that some women, including executives, attorneys, and doctors, were hospitalized to recover from relationships with psychopathic partners. These were high-functioning people reduced to cognitive disability by systematic psychological abuse. The neurobiological basis is established. Glucocorticoid receptors are particularly dense in the hippocampus, which is essential for memory consolidation. Chronic stress floods these receptors. Visual memory deficits develop and persist in those with early life stress. Here is what makes this clinically urgent. Executive function and verbal memory deficits predict worse response to psychological treatment. The cognitive damage makes it harder to benefit from therapy. The predator creates a trap that is difficult to escape even with professional help. Sign number 7 is fawning and self-abandonment. Psychotherapist Pete Walker, author of Complex PTSD From Surviving to Thriving, identified fawning as the 4th trauma response alongside fight, flight, and freeze. He describes fawn types as people who seek safety by merging with the wishes, needs, and demands of others. They act as if they unconsciously believe that the price of admission to any relationship is the forfeiture of all their needs, rights, preferences, and boundaries. The developmental pattern is documented. When a child learns that protesting abuse leads to frightening parental retaliation, they abandon the fight response. They delete the word no from their vocabulary. Flight is also punished. Freeze is not enough to satisfy the abuser. The only remaining option is appeasement, total compliance. The survival strategy becomes automatic. It operates below conscious awareness. Observable signs include excessive people-pleasing that feels compulsive rather than chosen, inability to express preferences or needs even when directly asked, saying yes when you mean no and being unable to stop yourself, hiding behind a helpful persona that does not feel like the real you, mirroring other people's opinions because having your own feels dangerous, tolerating abusive behavior without complaint, and most revealing of all, inability to identify your own wants or values when asked directly. Using polyvagal theory, fawning represents foot on gas and brake simultaneously. There's enough social engagement to appease the threat while simultaneously disconnecting from the authentic self. Unlike healthy compromise, fawning is automatic. It is non-voluntary. The person cannot stop, even when they are fully aware they're doing it. Now here is why this matters to you. These 7 signs, reality erosion, identity destruction, trauma bonding, learned helplessness, nervous system restructuring, cognitive impairment, and fawning, do not occur in isolation. They form a coherent clinical picture. They interact and reinforce each other. Reality erosion makes you doubt your perception of the abuse, which intensifies identity destruction. Trauma bonding keeps you attached, while learned helplessness prevents escape. Your nervous system restructures to maintain hypervigilance, which causes cognitive impairment. And fawning ensures you never resist. Think about your current relationships, not just romantic ones, family, work, friendships. Do you find yourself constantly apologizing when you have done nothing wrong? Do you feel like you are losing yourself, like your preferences and opinions are disappearing? Do you feel strangely attached to someone who hurts you? Do you feel unable to take action even when you know what you should do? Is your body always on alert? Is your thinking foggy? Have you forgotten how to say no? You might recognize these patterns playing out right now. The moment most people miss is how gradual it is. This does not happen overnight. It accumulates. Each sign builds on the last until the architecture of control is complete. And by then, you blame yourself. You think it is your weakness, your sensitivity, your inability to cope. It is not you. It is a process. Researcher Evan Stark's coercive control framework, now the basis for criminal law in the United Kingdom and Scotland, identifies the distinguishing features. Pattern, meaning an ongoing course of conduct rather than isolated incidents. Subordination, meaning the victim's autonomy, dignity, and liberty are systematically violated. And entrapment, meaning the victim feels trapped, even without physical barriers. The early warning sign to watch for is erosion of your reality testing. If you consistently leave interactions with someone feeling confused about what just happened, that is the signal. If you find yourself checking with others whether your perception is accurate, pay attention. If you are apologizing and you cannot identify what you did wrong, notice that. The test is simple. Does this person make you trust yourself less? Do you feel more stable and clear when they are not around? Do you find yourself managing their emotions at the expense of your own? The response is harder. Leaving is not simple when you have been conditioned to stay. Trauma bonds do not break just because you decide they should. Learned helplessness does not lift because you understand the mechanism. But pattern recognition is the first step. Once you see the architecture, you cannot unsee it. And that seeing creates a gap, a moment of clarity between stimulus and response, where choice becomes possible again. The limitation is real. Understanding what is happening does not automatically free you. It is necessary, but not sufficient. Professional support from someone who understands coercive control specifically is often essential. This is not therapy that focuses on your childhood or your attachment style. This is help that recognizes you are responding normally to abnormal treatment. Here is what the research ultimately shows. Manipulation does not work because predators are powerful. It works because you want to believe. You want to believe the good version of them is real. You want to believe your perception is wrong because the alternative is too painful. You want to believe it will change because you have already invested so much. The vulnerability was always there. It is human. The predator simply learned to exploit it. Now you see it. The only question is, will you keep watching it happen? If you want to keep seeing what others miss, subscribe. The next video goes deeper.